and welcome to our session, Food Systems Impacts on Children's Rights. I'd like to thank people in the room who have joined us in person, as well as those who are participating online. And of course, I'd like to thank our speakers who have joined us today in person to join the first, I hope, of many more future food systems discussions and child rights. I'd like to firstly just introduce our panel very briefly. On my right, my far right, is Isaiah Sugitun, who is our Fix My Food UNICEF youth changemaker. And then we have Dr. Pech, who is from NCD Alliance, Thailand. Thank you very much for coming. And also on my right here is Cassidy Huang, who is from the World Benchmarking Alliance. Thank you very much for joining us, Cassidy. And on my left here, far left, I've got Dr. Adrian, or Professor Adrian Cameron from Deakin University, who's flown in all the way from Melbourne. Thank you very much. And then, of course, I've got Samir Sheikh, who's from Access to Nutrition Initiative, who's also flown a long way to join us today. I think from the Netherlands, that's right. Thank you very much indeed. And we are going to kick off the session with an opening from Isaiah, who's going to set the tone for us to describe his experiences of the food systems. Thank you, Isaiah. Over to you.
Isang masustansyang araw po sa ating lahat. I am Isaiah Emmanuel de la Cruz Sugitan, an alumni member of UNICEF East Asia and Pacific Regional Office's Young People's Action Team on Health and Nutrition. In my experience, unhealthy foods rich in fat, sugar, and salt not only have been normalized, they have always been at reach within children and young people as well. When I was in my school, it was actually situated close to convenience stores, fast food chains, and street foods that sold unhealthy foods. It was quite hard to find a carinderia or home-cooked food stalls that sells fresh food. As a result, it shaped the foods that we always loved to eat. And this is the same for my peers. When you ask them what they'd like to eat, they'd say pizza, cookies, or burgers, nothing to do with our traditional diets. It's also common to see young people after school buying a milk tea, or we call it boba or bubble tea, because it's cheap, delicious, and within few meters from any school. I'd be a hypocrite if I didn't admit that I used to drink milk tea almost every day after class. Not to mention that milk tea shop that I go to all the time had very appealing marketing tactics. I can vividly remember participating in it through a photo contest where participants would post their photo with the milk tea, have people like it, and the shop's page on Facebook, and say why we love drinking milk tea. For the person with the greatest number of likes, the winner gets 30 free milk teas consumable within 3 months. I didn't win, by the way. How I wish, though, at the time. I won second place. Looking back, I was not aware about this tactic. I only saw the opportunity to get free sugary drinks without knowing that these drinks are empty calories. How can we link healthier options to children if the food system makes it harder to be healthy? This vision of bringing healthier food to children and young people has been my personal advocacy, which led me to being in the Fix My Food initiative of UNICEF. Me and my fellow young people are directly affected by the food system, whether we realize it or not. We eat food daily, yet we don't get to know how the food we consumed is processed. We use social media, and our pages are bombarded with colorful ads and cartoon characters that promote unhealthy foods. Through the Fix My Food initiative, I was able to find some answers on this pursuit of mine through the lens of my fellow young people. I have explored food environments over the past year from over 13 countries, and we found that unfortunately, the food we eat, the choices we make, are beyond our control. Especially, we also found that unhealthy foods are notably pervasive, and how healthier food options, especially in urban areas like Manila or Bangkok, are much harder to find. we found that companies target young people through marketing tactics that use engaging media to entice us to buy their products. And lastly, we found that healthy food is a lot more expensive than unhealthy foods. While I cannot take the experiences I had back when I was in school, we can do something today. We can create a generation where healthy foods are more available for young people. We can create a society that celebrates traditional food, foods that represent our own cultures here in East Asia Pacific, which globally is known for bright and bold flavors. We can create a tomorrow that makes healthy food, regardless of your socio-economic background, is accessible and affordable for everyone, especially the young people. Maraming salamat po.
Thank you very much, Isaiah. You've really set the tone. I really loved that you told us about your social media experience, and I think we're all susceptible to those marketing tactics. Before we begin the panel discussion, I'd just like to reflect on two reports that UNICEF recently published on the 10th of September. Our global report called Feeding Profit, as well as our regional report called Turning the Tide on Childhood Overweight in East Asia and the Pacific. Both reports focus on overweight and obesity among children and the astounding figures, which I'd just like to share with you today in case you haven't read the report. And if you do want to see the report, we have a QR code outside the door here. So out of 427 million children across the world who are living with overweight, 113 million of them live in East Asia and Pacific. That's about a quarter, or 1 in 4 children in our region that are suffering with overweight or obesity. This is compared to the global figures, which is about 1 in 5. So it makes a very compelling case that we need to act, and we need to act fast. This is accelerating rapidly, and these figures globally have doubled since the year 2000. So in about 20-25 years, they have doubled. And the extreme form of obesity is rising faster in this region than the global average as well. So whereas obesity has doubled globally in East Asia and Pacific, it has increased 4.5 times. In addition to that, another startling finding is that obesity is more common than overweight now. This was predicted, but now it's actually shown in the figures. Among 5 to 19-year-olds, there are around 50 million of children living with obesity, compared to around 26 million who are underweight. And of course, this is no longer a problem of wealthier countries. The data is showing us that nearly 1 in 3 children affected now live in a low or middle income country. And the costs go far beyond health. While according to the latest estimates, overweight among all population groups currently drains around 409 billion from national economies. And by 2060, it's predicted to be around 12 trillion, which is startling figures. So I think that sets the tone for the rest of the panel discussion. The reports talk about the figures, and we also talk about the environments that are promoting this problem and leading to this problem. And that's why we've had this panel discussion and set up with our speakers today. And my first question really then will go to Adrian. Adrian, can you tell us how food systems influence children's nutrition and their right to health, please? Thank you.
Thanks, Alison. Yeah, I think Isaiah really set the scene well, and he showed the way that children, they grow up surrounded by food. And it's the places where children buy food or where their parents buy food for them. So places like convenience stores, like supermarkets, like fast food outlets, and increasingly now online food delivery sites as well. That's the interface between the broader food system and our children. And they're growing up surrounded by food, but they're growing up surrounded by unhealthy food. And I think this generation of children are growing up with a social norm that unhealthy food is normal. And it's in those kind of shops, so supermarkets, convenience stores, fast food outlets, that's where retailers, but also food manufacturers, they use marketing tactics to really actively influence what kids see, but also what they buy and what they eat. And so marketing is things like deciding what food is available in a store, what's price discounted, where food is placed, prominent displays like checkouts and end-of-aisle displays, and celebrity endorsements as well. And our research over many years has shown that the marketing in supermarkets and convenience stores is nearly always strongly biased toward unhealthy food. And then the marketing they see in stores is obviously, as Isaiah said, reinforced by what children are seeing online as well. And so it can be hard in the moment to see how the food system changes over time and how it impacts behaviour and health. But one way we tried to do that is using some data that was available that looked at the way retail has changed over the last 15 years in 97 countries, and 14 of those countries were from the East Asian region. And two key findings from that study, I think, get to the heart of why we've seen those statistics that you mentioned there, Alison, and where the big problem lies. And firstly, East Asia was one of the regions with the fastest growing number of chain retail outlets, so that's supermarkets and convenience stores per person. And not only the number of chains, but also the sales of unhealthy food from these chain retailers was also rising fastest right here. And second, we saw a really striking positive association between how fast the number of supermarkets and convenience stores increased and how fast the prevalence of obesity increased in a country. And I think that the fact that we focused on chain supermarkets and convenience stores and saw that association with obesity is really telling. And I think it's symptomatic of the problems in the food system. And that is that chain retailers are huge retailers. They're big corporate entities, and they often have the biggest market power. They have the most sophisticated marketing strategies. They also have the strongest links with multinational food manufacturers, usually of unhealthy, ultra-processed foods, and they also have the most influence on governments and NGOs. And so our research and our experience of working in partnership with UNICEF in Asia has shown us that these retailers, they typically are doing very little to improve the health of our children. And that's partly because nobody's making them do that, but it's also because they often don't even know where to start. So I'd finish, Alison, by saying that there are few, if any, countries in the world that have actually been able to halt or reverse that epidemic of obesity. And I think that's because the action that's needed to do that is so bold to work against the really powerful commercial influences on our health, that it's really challenging for governments and others to do this. But I think definitely not too late to do that in this region.
Thank you very much, Adrian. That's really interesting. And we can discuss after the work that UNICEF is supporting for the region on retails and how we can try and influence retailers to improve their healthy food offerings. Dr. Pitch, I have a question now for you, and we're going to sort of focus on Thailand. Can you tell us about the situation of overweight and NCDs among children? Thank you.
Thank you, Alicia. Before I go to the preference on the burdens of diabetes and also obesity in Thailand, I would say that my experience 30 years in take care of people with diabetes and other NCD disease, we achieved just 40% of people who achieve the target goal of treatment, and the tsunami of diabetic complications and other NCD disease complications such as cardiovascular disease and end-stage renal disease have developed rapidly. We try to produce expert healthcare professional to combat these NCD consequences, but I think we have to look at another way around. Now we have seen the information from National Health Exam Survey last year that the obesity in Thai people rising from 40% to nearly 50% just in 5 years, and compared to the last 20 years, it's about double of the number. And also the important data from UNICEF public last week, I think the Thai people in young children have obesity about 14%, which is doubling the number we have had before in the past 25 years. So I have to look back at NCD Alliance. We gather the expert from cardiovascular, kidney, hypertension, and so on, about 30 organizations, health organizations to combat the NCD. We have looked at this information and say that the source of obesity and NCD is not come from their behavior itself, but these people living what we said obesogenic environment. So what we have to do, we have to change this environment to a healthier environment. And if we look at this environment, what are in this environment? The most important thing in Thailand is the food marketing, I think. You can go anywhere and have some kind of packaging food and we have a look at this item. Nearly 80% of them in a convenience store have high in fat, sugar, and salt. So what we have to do, we have to change as well. But before we change, we have to make these people have a good health literacy to make decision. But if you look at the children, why they can't do or they don't have the factual knowledge on the healthy choice? Because people or young children in age less than 14, they don't have capacity or ability to make decision on abstract. They just do what they have seen. For example, the media, the color, and the beautiful or influencer, and they follow them. That is a reason why we have to take action on this, because obesity in children, not just only obese, but their body produce a lot of fat cell and will process to adulthood. We have found that people who have diabetes less than 30, they have type 2 diabetes instead of type 1 diabetes, and 70% of them are obese. And also, we have followed up them for a couple of years and found that they develop long-term diabetic complication more rapid than people who have type 1 diabetes. So this one is serious, not just obesity, but it's a thing about their complication and consequences. So we have to look back at the very beginning of the disease, eventually in young children. That is answer your questions? Okay, thank you.
Thank you, Dr. Pech. It's really startling to hear that what follows obesity is diabetes, and it's a really hard condition to manage and control. And that is what we would like to prevent, ultimately. And over to Samir. We're moving to the work that you do, and can you tell us a bit about why healthy food systems matter to companies and investors and governments? Over to you.
Thank you, Alison. I'm going to, well, for those who walked in a bit later, I'm representing the Access to Nutrition Initiative. We are a global nonprofit that work to transform markets so that nutritious and healthy food is available and accessible to all. And I'm going to zoom out a bit and start with some of the statistics that you opened with, Alison, on overweight and obesity that we're seeing globally. So for the first time, overweight and obesity, children and adolescents that are living with overweight and obesity have surpassed the number of children living with undernutrition. And this is really felt more heavily in low and middle income countries. More than 80%, the report quotes, the Global Child Nutrition Report. So this is already, in terms of human costs, it's a stark illustration of how our food systems are failing and why they matter. They matter for children's rights, they matter for economic development as well. And in terms of economic cost, it's just as stark. You quoted some figures already. There are also other estimates that show the cost of inaction over the next decade. So $21 trillion would be lost in productivity losses related to undernutrition and micronutrient deficiencies, and overweight and obesity would add a further $20 trillion in terms of economic and social costs. And again, like with human costs, these will be more heavily felt with governments, by governments that can least afford them. When we look at the industry, the companies, the private sector, it's also not just a matter of social responsibility anymore. It's also very much a business risk in terms of long-term growth and resilience. So we know, and data shows, that poor diets are translating directly into worker productivity losses. They're also leading to higher absenteeism and already costing companies billions of dollars every year. And at the same time, we also see that the environment is shifting as well. Consumers are demanding healthier options. There's tightening of standards around food. Regulations are tightening, and reputational risks are also growing for companies that will not adapt. So it is in their interest to act now, to start reformulating products, build better strategies, and position themselves well to reduce this risk as well. And in our work, and I'll share more examples later, but in our work with investors as well, we're seeing that nutrition is increasingly being recognized as a material issue. So an analysis we conducted earlier found that companies that have broader and healthier portfolios have higher profit margins and also higher valuations than compared to their less healthy peers. So it really shows that companies that are systematically integrating nutrition into their business models will do better long term as well. So ultimately, to sum up with, just to say that building food systems requires alignment. So governments need to set the right incentives and accountability frameworks. Investors need to direct their capital towards companies to encourage them to incorporate nutrition in ESG frameworks and guidelines, to demand more. And companies need to make healthier choices also available and accessible to consumers. Thanks.
Thank you, Samia. That's really helpful from a business perspective. And we see in our research that we do with Deakin that consumers are really voicing the need and the want to change. Thank you. So Cassidy, over to you from World Benchmarking Alliance. What trends and gaps does your organisation observe from business and industry practices in limiting the exposure and availability of unhealthy UPFs to children?
Thanks, Alison. So I'm from the World Benchmarking Alliance, where we assess and benchmark the world's most influential 2,000 companies on their sustainability performance. And in our food and agriculture benchmark at WBA, we assess 350 companies, including a lot of household names like Unilever, Nestle, and McDonald's. So you can imagine these are really the companies that directly shape the food environments children grow up in. And when we look at some high-level data of their performance in nutrition, there are three critical issues. The first one to start with is the availability of healthy food. So we want to look at whether companies are making their products healthier, for example, by improving the recipes or putting more nutritious items into their portfolios. And based on our benchmark assessment results, only 18% of food companies that sell directly to customers report on improving the nutritional quality of their products. And just 5 of them have set targets to increase the share of healthier options. And when we look at restaurants, which obviously play an essential role in, especially in Southeast Asia, where many families actually eat out or do takeaways every day, out of 29 restaurants we assessed, this includes, for example, McDonald's, Starbucks, etc., only 3 of them show evidence of improving their menus, and none of them have committed to expanding healthier options. And the second issue is accessibility of healthy food. So even if healthier options exist, are companies making them affordable to families through, for example, pricing or promotions? So the gap here we've seen is that very limited disclosure and there's a lack of transparency. So companies generally avoid disclosing pricing strategies, which makes it harder for us to see whether these nutrition foods are actually becoming easier for children to access, especially for low-income families who often have to prioritize cheaper and healthy options. And on top of that, we noticed that only 99% of the companies have no public targets to make healthy foods more affordable or accessible for low-income families. So this just shows how little priority healthy food affordability has in corporate strategies. And the last one is marketing. I think a lot of speakers also mentioned this point. So even if healthier foods are available and affordable, if children see, for example, ads for sugary drinks every day on social media, like the Coke I just bought today, they're still not protected from being steered towards unhealthy foods. So on a positive note, we found that the majority of global food and beverage companies do disclose marketing policies that include some restrictions to protect children. But the issue here is most only apply to children under 12, so this is far below the UN standard of 18. And none of these companies actually use government-endorsed nutrition criteria to decide which foods can or cannot be advertised. And most policies really fall short of the WHO and UNICEF recommendations. So what we see is that the policy that exists are too weak to offer real protections, and the result is that children are still heavily exposed to the marketing of unhealthy food. So there's really a chain of responsibility here, from the way the food is produced to how it's priced and promoted. We still see structural gaps that remain to be closed in corporate practices.
Really interesting. Thank you, Cassidy. And, you know, that brings us to the point about Thailand, actually, and regulations. Dr. Pech, my second question to you is, you know, what is the role of non-health actors and how businesses can systematically change the situation in a sustainable and accountable way, particularly with regards to Thailand?
Thank you. As I said, with my experience, I've seen that the NCDs root from human behavior and obesogenic environment, that we have learned a lot about the business and industry that have a lot of packaging food that have high salt and sugar in the package. So it is not possible to healthcare professional only to take action to these campaigns or this activity. I think the multi-sectorial participation should be worked congruently. They have to work in the same pace, and also collaboration in the orchestration for a company and private sector, government sector, and academic to work together in the same pace. If we focus on nutritional environment for better health, I think about three components. One is demand side, another one is supply side, and the last one is the supporting system. For the demand side, it is important to make people have ability to choose their healthy choice, and also the health literacy of people, even in very important for children to have health literacy. And for the supply side, I think the reformulation that some people said is very important. Today, there are a lot of food side advancement to make this possible. So it's not difficult to cooperate with the university or Department of Nutrition to make a new healthy diet for people. The second one is, which is problem in Thailand, is food labeling. It is very, very difficult to read, a lot of information, and a lot of difficulty in interpretation. So what I need is to make the food label more easy to understand and noticeable and understandable for people. The third one is healthy food marketing. I think the company that have a lot of products that have high salt or high fat, even more, can produce the healthier product, and they can promote them, as well as to promote healthy behavior, such as physical activity for their consumer. This is truly the, I think it's truly social responsibility of this company to do the healthy promotion for their consumer, not just go to the forest and have some tree forest as well. And for the supporting system, I think this is very important to foster this process to go on very smoothly and orchestration, because if they or we did not have any regulation or law, they can work in a different way. And the competition between companies is not fair. So if we have the same rule, for example, the rule for produce or label the product in the same way for people can understand in every company, it's a fair market. And it's possible to do. And also, the Ministry of Public Health is trying to promote the act on control of food and beverage marketing affecting childhood behavior and health. This one might be the first step to make all company co-worker and also the academic to make the advertisement or information for the patients or people in the same correct way and not direct them based on influencer or the wrong way. So this is, I think, the first important step for Thailand to do the act on control of food and beverage marketing. And the last one, I think, the act for the best outcome and the event to take time should be started at the very beginning, which is in our children. Thank you.
Thank you very much, Dr. Bech, on reflecting on some of the work that Thailand is championing. I think I know of 2 countries in the region that are working very strongly on marketing regulations. Thank you for that insight. So, Samir, back to you. I would like to know a little bit more about ATNI's perspective on the progress to date amongst the companies that you assess. What kind of progress are they making, and could you reflect also on any obstacles that you're observing as well? Thank you.
Yeah, thank you. So the short answer is yes, we do see progress, but it's not enough and very slow. So in our global benchmark, where we assess some of the largest food and beverage companies over more than 10 years now, we've seen that globally companies derive 34% of their revenue from products that are classified as healthier. This is up from 31%. So there is movement in the right direction, but not enough movement, and it's very slow as well. We are seeing more companies are now setting nutrition strategies and reformulation targets with respect to salt, sugar, trans fats, etc. But these targets are rarely tied to overall portfolio, so they're not proportional. And they also often rely on companies' own definition of healthy and not linked to internationally recognized nutrient profiling models, which we want to see. We also see a discrepancy in how companies implement their global policies in emerging markets. And that is obviously an obstacle as well when we consider accountability and trying to measure compliance as well. In terms of marketing to children, we have seen some progress, and Cassidy already touched upon this a bit. So 10 years ago, companies were very reluctant to raise the age thresholds of their marketing policies to even 12 years. We see a few have now moved to 16. But that said, no company has yet adopted a comprehensive policy that aligns fully with WHO and UNICEF recommendations in terms of the product restrictions they include, the age thresholds these policies apply to, and the marketing techniques, especially when it comes to digital marketing, they fall short. And in our infant and young child nutrition work as well, from our marketing of breast milk substitutes and complementary foods indices, we've also seen that none of the companies that were assessed fully align with the code. And also here we've seen that digital platforms are where majority of non-compliance occurs. In terms of our investor work, engaging with investor, that has been a bit encouraging. More investors are now using our benchmarks and our data to try to encourage companies to embed nutrition in their policies. So that's encouraging to see. In terms of obstacles, I mentioned a few already: implementation gaps, Commitments are not translating into measurable scaled impact across product portfolios. Aggressive marketing of unhealthy food is still pervasive. Other speakers have also spoken about it. We also see policy and data gaps, so weak regulation and enforcement in many markets, which causes uneven incentives for companies to act. And in some cases, we've seen recently in our work in East Africa that many governments also lack the data on the healthiness or the nutritional quality of the products that are available. They don't have that data to then that would feed into these policies. So to sum up, what's needed going forward, stronger accountability frameworks, hold companies to account on their commitments, regulatory measures that create a level playing field for companies, and investors continuing to encourage and put pressure on companies as well to align their business models with public health and with children's rights.
Thank you very much, Samia. That's really helpful to contextualize the business element and the changes. There is progress. It looks like it's slow, but I'm hopeful that there is progress. Back to you, Cassidy. I would like to talk a little bit about the investors and the challenges they see in the long term and how they can influence business practices. Over to you.
Thanks, Alison. I think Samia just shared some really encouraging trends they observe during their engagement with investors. But in our experience, we see that investors are still less focused on nutrition compared to other issues, for example, like climate or biodiversity. At WBA, we've been convening investor roundtables, and we see that topics such as protein diversification or healthy food marketing are not yet considered as major material risks to their portfolios. So that's why we've been working on packaging nutrition together with climate and nature and showing that there's actually a triple win when investors address these issues together. So the way we make this real for investors is by highlighting the overlaps. For example, shifting protein sources can reduce its GHG emission, but also relieve pressure on land and water while improving diets. And similarly, cutting food waste protects ecosystem and also ensures more people have access to nutritious food. So our benchmarks identify these crossover areas, including soil health, food loss and waste, sustainable seafood, etc. And by 2026, we'll publish an investor guide with clear KPIs. The idea is to give investors the tool to act on climate, nature, and also health at the same time, and to make nutrition part of the core investment case rather than just a side issue. But I'd also like to highlight here that investors are just one lever. At WBA, we think in terms of pressuring and learning pathways to change corporate behaviors. So on the pressure side, so influence comes not only from investors, but also other important stakeholders that have direct influence over companies. For example, civil society, youth advocates, media, and also standard sectors. For example, we've been working with organizations like ATNI to push for stronger corporate accountability on nutrition, and we're now also partnering with youth-led groups such as AfroFoods to advocate for tighter rules on marketing unhealthy food to children. And on the learning side, it's also important that we stimulate sort of the internal motivation for companies, and we provide the tools and guidance they need to empower them to change their behaviors. And companies often ask us a very basic but also important questions. What do good practices look like? And our methodology serve sort of as a roadmap because it really laid out sort of clear expectations grounded in global standards, and they're publicly available online so that companies can look at the requirements set for them and sort of work towards the requirements they're expected to achieve. And we also complement this by publishing leading practices so that companies can see what high performance looks like in their practices, especially for their peers within the same sector or within the same region. And we also host peer learning sessions, which creates a safe space for companies to share their experience, the obstacles they face, and also their solutions to these challenges so they can learn directly from each other. So investors are just part of the solution, but not the only one. I think real changes come really when companies are pushed to act, but at the same time, they're also given the clarity and tools they need to improve their practices.
Thanks very much for clarifying that. It's been interesting the last couple of years when we've seen the focus on investors, and it's nice that you've broadened that argument for us. Thank you. So, Adrian, I've got one final question for you to try and wrap up our panel discussion. So what do you see from your perspective as the priorities for action in East Asia Pacific? And are there any tools available to help support improving the food systems for children? And could you also talk about the retail system in particular, please? Thank you.
Yep, definitely. Thanks, Alison. First thing I would say before I get onto the tools is that I think the opportunity in this region in particular is huge. I think there are many countries in the region where the nutrition transition is still happening in real time. And so I think that's where the opportunity is to direct, as the number of supermarkets and convenience stores start to dominate in those countries, it's directing that change to make sure that those retailers and those food manufacturers are creating an environment that doesn't damage the health of children. It's very hard to change a retail food environment once it's established, so I think there's a huge opportunity there here. But in terms of how you might do that, I think governments can certainly do that with regulation, and I think to me, it's all about being ambitious enough with the change that we want to see. And where I look for inspiration is the UK government, actually. So just recently, they've introduced regulation limiting the price promotion of unhealthy food in chain retailers. But just a couple of months ago, they've also mandated reporting the sales of healthy and unhealthy food by chain supermarkets. And they've asked those retailers to set targets that they need to meet themselves. And I think in a global first, what they've said to the retailers is, we want you to meet those targets, but we don't care how you do it. So you can do it however you want to, but it's the sales of healthy food that you've got to increase. And I think that's, that big picture approach is really important. And it really might surprise some people to know that the retailers in the UK are actually, several of them are openly backing these changes. The retailers don't actually necessarily want to damage the health of their customer base to gain a competitive advantage, but it's what they're being demanded to do by their shareholders. So I think they're asking for that level playing field which can be created by governments. And while I'm talking about governments, I guess the big picture here is also corporate power. A lot of the biggest problem companies are also the biggest companies. That's obviously a hugely difficult thing to change as well, but I think the structure there of companies is also really important. So that's in terms of what governments can do. I think we can also help retailers to make changes themselves and to know what to do and how to do it. Often retailers don't even know, what we mean by healthy food. So I think that's there's a lot of work to do there. We don't want just publicity stunts, which is often what we see, short-term publicity stunts. We want effective and lasting change that influences what children eat. And so I think as well as government action and voluntary action by retailers, helping them to sustain and scale up that change, I think accountability is really key, and I think it's been really important to have World Benchmarking Alliance and Access to Nutrition Index here as well, because they are holding these companies to account, as well as the Informus Food Environment Monitoring Network are also doing good action in that area. And in our own research, we found that some of that monitoring activity can be important in its own right, a powerful way of making change. But I think it's the combination of the monitoring and accountability with the government action and helping retailers to actually make the change. I think that's what we really need, and I think that's why this sort of forum is so important. So I'm pleased to be here.
Thank you very much, Adrian. I just wanted to reflect on a point you made about retailers not knowing what a healthy food is, and that's definitely been our experience working alongside you with some retailers. And it's definitely an entry point for governments to set what the standard is for healthy food, such as categorizing those that are healthy and unhealthy. I know ATNI has done a bit of work on that as well. But we find in our work that retailers, that's a pushback moment when they say, well, we don't know, and we were waiting for government to categorize those foods. And then there's this delay that happens as well. So thank you for mentioning that. It's definitely a role for governments. I don't know if either of you, Adrian or Samir, want to reflect further on that element.
Oh, I think you've summed it up there, actually, Alison. That's exactly what we've seen. And, you know, I think all of us, if we went into a supermarket and we walked down what they call the health food aisle, I think we would all see how much trouble they have identifying what is healthy food.
And just to add, this is also why companies using their own models can be problematic, because we need ideally government-endorsed models that we can use to then compare as well, and they have one standard of what's healthy and not healthy.
Thank you very much. I'm really pleasantly surprised that all our panelists kept to time, and I'd like to congratulate everyone, which allows us some time for questions from the audience, whether you're in the room with us or online. Oh, we have a hand up already. Yes, would you like to also introduce yourself, please, where you're from and what your name is, and your question?
Thank you very much for very insightful panels. I'm Prim Rajasurawan. I am a youth advocate. And I would like to mention the impact of climate change coming into our food systems as for contamination of food, intoxication of plants, where these also become the ingredients that we use to cook as the food that we eat. And it is also a part of the supply chain or the value chain when businesses take these kind of plants, these kind of ingredients to cook and to make and then to process these kind of food. I would like to ask about what kind of technology or innovation or business innovation comparative that it could make healthy food kind of last longer. That because other processed food that were made to have a longer shelf life, which gives them economic imperative for restaurant that they choose these kind of unhealthy food to cook because it lasts longer, it can hold them longer inventory time. And as young people, as children, we look about food in terms of their ingredients, their sourcing, and their flavoring of the food, like dressings when they are monosodium glutamate. They are all kind of chemicals that make the food more tastier. And how could we make these healthy food, also become tastier for all of us? Thank you.
Wow, that's a big one. Thank you, Prim. I'm happy to respond, but I'm not a panelist, and I'll defer to others if they would like to respond on that, because that's a really big question that you've raised, you know, the healthier alternatives that we're talking about. And UPFs have a role because they have been developed to have that long shelf life, which was a need, but now we're seeing the health outcomes of that and the impact on environment, right? And that's what you're raising. I'm just going to pause there and allow anyone on the panel, if you'd like to respond to that, anything you've seen in business practices or your research. Adrian?
Yeah, thanks very much for that question. I'm glad you raised the issue of climate, actually, because it's a big opportunity. And that's partly because there's a lot of overlap between the foods that are healthy and the foods that are good for the environment. You know, fruit and veg is what's best for us, but it's also typically got the lowest environmental impact as well. So there's a huge opportunity there. And I think from a food system point of view, you know, if we're talking about governments and if we're talking about food companies, they actually will often respond more strongly to environmental imperatives rather than health imperatives. And so I think we can kind of use it as a double duty action to really increase action on health. So I think it's a really important one to focus on.
Thanks, Adrian. Cassidy, would you like to comment?
Yes, I think just adding to what's been shared. So if we package sort of the nutrition issue and the healthy food issue together with climate and nature, so these are real material risks that investors care about and companies care about. I think the combination of both will make it easier to sort of establish a case. So nutrition is tightly associated with other risks that are happening in the world right now, and this is something that would create an opportunity for us to engage more attention, especially from the decision makers and company, to invest more in producing healthier food and promote nutrition. And another thing I think of is whether we can make a business case for nutritious food. This is also something we're exploring at the World Benchmarking Alliance to look at whether some of the company's sustainability performance could be linked to their financial performance and linked to nutritious food. How can we make healthier food also profitable? Because we keep talking about the marketing of healthy food is because companies actually make a large amount of profit from it. So I think if we could establish a business case to prove that actually sort of selling healthier foods or making healthier food profitable could be a solution for companies, I think there would be more sort of investment and attention sort of generated for that issue as well.
Thanks very much, Cassidy. Thank you very much, Prim, for that question. Would anyone else like to ask a question, whether you're online? Oh, yes. Over to you. Would you like to introduce yourself, please, as well?
Yes. Good morning. My name is Mangesh Manor Deshmukh in India. My two questions, ma'am. First question, UNICEF faces challenge in the addressing the impact of the food system of children's rights. This is the first question. And second, is the help that every country needs to solve all the problems getting the help it needs?
I'm sorry, can you repeat the first question?
UNICEF faces challenges addressing the impact of the food systems of children's rights.
Yes.
And second is the help that every country needs to solve all the problems getting the help it needs.
I'm not sure I understand the context of that question. Could you elaborate it, please?
UNICEF faces challenge.
Yes.
When any problems faces UNICEF? This is my first question.
Is that what you're asking?
Yeah.
Oh, sorry.
Yeah.
There are multiple challenges that we collectively face.
First question, UNICEF faces challenge in addressing the impact of the food systems on children's rights.
Yes.
And second is the help that every country needs to solve all the problems getting the help it needs.
From UNICEF or from other stakeholders?
Other countries.
I think collectively we are all working on these different problems together.
Yes.
And UNICEF works alongside other stakeholders to support governments in addressing these problems. Yes.
Yes.
And part of that work is bringing in other stakeholders, including the organizations, the NGOs, civil society, academics, to bring attention, generate data, and also help develop solutions. And it is a collective effort.
Okay.
Thank you.
Okay. Welcome.
Is anyone else wanting to raise a question? Carla, please introduce yourself for everyone else. Thank you.
Thank you very much, Alison. It's great to see this agenda being addressed for the first time in a forum of business and human rights. So very pleased to see the discussions, and thank you so much for that. My question is about the role of investors and the benchmark initiatives. Maybe the two colleagues who are here today, just to share more with us, how do they see the change also in these standards, and how do they see the change in the investment decisions? I know you have spoken about some of the issues you encounter in your organizations, but I wanted to see, we still see these companies being ranked very highly as sustainable companies. Based on this discussion and the changes that are happening in the standards, how do you see the changes happening in terms of investments and the results of the benchmarks? Thank you.
Would either of you like to volunteer to go first? Cassidy or Samir?
I think it's a bit relative, Carla. So we are seeing nutrition being integrated more and more in these investment frameworks, but it is a start. And I think if you're speaking relative to other metrics or just in terms of time, before and after a bit, I think you have to see it in that way. At ATNI, we have an investor signatory network that sign up to what we call the investors in nutrition and health, investor expectations in nutrition and health. And we have a network of 88 institutional investors that sign up to that. And they own about 20 trillion in assets under management as well. And we have seen in terms of recent successes that our indexes and reports are being used in investment analyses, in ESG research and engagement with companies. So the S&P Global Corporate Accountability Framework now uses some metrics on product healthiness. They're also being integrated in the proposed draft metrics for ISSB. So those are some examples I can share from our work.
Cassidy, would you like to chip in?
Thanks for the question. So for our food and agriculture benchmark, there were actually only 2 iterations. So one was conducted in 2021, and one was conducted in 2023. So probably from the high-level data, I cannot sort of directly answer this question because there has been methodology changes. But I can speak from another angle, sort of the strategies that company have set and the targets that have made. So I think in the first iteration, there has been less attention given to sort of making healthier foods available. And in the company strategies, we see there are less companies sort of improving, disclosing their strategies to improve the nutritional quality of the products. But in the second iteration, we do see that at least there are more companies who are disclosing strategies on availability of healthy food. And some of them have disclosed targets to increase for example, the sales target of the share of healthier options. So this is one of the progress that we've seen have been made due to a lot of the regulatory changes, standard settings, etc. And the second one, I think, Samia also touched upon that, is in terms of the marketing restrictions. In the second iterations, we do see that a lot of companies at least mention there is restriction for marketing of unhealthy foods for children. And this is a progress we've seen. It's just what's lacking there is whether these restrictions are based in sort of the government-endorsed profiling system or whether it's based on sort of the WHO and UNICEF recommendations. So this is something still lacking. So we see the progress as more companies are making commitments, more companies are making strategies in terms of availability and the marketing of healthy food. It's just there needs to be more clarity and sort of the standards incorporated into company strategies.
Just to add maybe more of a concrete example, so in how investors can use these benchmarks as well. In 2021, there was a shareholder resolution coordinated by Share Action in the UK and supported by our data, which called for Tesco in the UK to increase its sales of healthier products and disclose progress. And in response, Tesco made the commitment to increasing healthier products sales to 65% by 2025, so this year. So this just shows sort of the power that data can have. And, in response, the shareholder, the resolution was then withdrawn. So just to show you in concrete terms how these wins happen. They do happen in isolation, though, so it's a bit relative, yeah.
Thanks very much, and that just makes me think about the collective action and consolidating our partnerships, which is why we're here today. Okay, I think that would have been the last question, but before we wrap up, I'd really like to ask Isaiah to please come and share with us your thoughts. Thank you very much.
Hello again, everyone. We have heard the data, situation, and roles of various sectors, including businesses, in shaping our food systems. But I want to take this opportunity to speak more about what we children and young people want to challenge you all moving forward. I want to make 5 salient points. First, we hope to make food environments that incentivizes eating healthy food, especially among children and young people. Through the Fix My Food initiative, we saw how unhealthy food ads have bombarded all areas near child and youth spaces like schools. We have also seen how nutritious foods are much more harder to find, and they tend to be more expensive. If we want to make spaces healthy for children and young people, we must bring the options to them at an accessible and affordable manner. Second, strengthen policies on front of pack labeling to ensure consumers are aware of the ingredients their food contains. In Southeast Asia and Pacific, only a handful of countries have implemented mandatory policies where food manufacturers must declare the nutrient content of their food upfront. The Philippines is also one of the countries that don't have this yet. Yet, the leading causes of mortality in the Philippines are mostly in the non-communicable diseases which are preventable. It is also notable that data shows that more young people are suffering from elevated blood pressure, elevated blood glucose levels, and more, which places them at higher risks. Let's recognize the urgency of this issue to act now and not wait for the numbers to go higher even more in the near future. Third, ensure the avoidance of conflicts of interest and corporate capture in policy development processes. In my experience, I witnessed big food companies infiltrating the governing bodies and stakeholders that work in the development of systems that categorize unhealthy foods, or the nutrient profile model, as we have called it. Corporate capture has been embedded in the system, yet it remains to be an elephant in the room. In some instances, big food companies counter-argues the use of ultra-processed foods, or UPFs, to combat food security. However, food security goes together with nutrition security, which also ensures that everyone has access to not just any type of food, but nutritious food that prevents diseases. This has already affected the young people heavily, given that UPFs are accessible to us. We need to ensure the prevention of conflict of interest and corporate capture at all times. Fourth, regulate marketing practices, both offline and digital, to avoid targeting children and young people. As I have shared earlier in my personal experience, I have been targeted by this long before I became involved in nutrition. With the emergence of new social media apps and technologies, marketing companies become more creative with luring children and young people to unhealthy foods. Children and young people are more lured into consuming UPFs that are not culturally relevant, and I am concerned that it pushes traditional foods out of the minds of children and young people who are exposed to social media, and there is a strong need to create awareness. Lastly, our voices matter and should be heard and embedded in the transformation of our food systems. While we are directly affected by the food systems, it is hard for us to join policy spaces due to systematic barriers. By providing support to us, we can create child-friendly and child-responsive spaces. Investing in young people is crucial since food systems transformations not only concern our current young people, but also the succeeding generation of leaders who will be in your places soon. To sum up, on behalf of the youth of Fix My Food, I would like to challenge all of you to 1, promote and incentivize the availability of healthy foods. 2, strengthen front-of-pack labeling policies. 3, ensure the avoidance of conflicts of interest in policy-making processes. 4, regulate marketing practices, both offline and digital, to avoid targeting children and young people. And 5, ensure that youth are part of these conversations. May our efforts and struggles ever be in our favor to bring good health and nutrition to our children. Thank you.
I cannot add to that powerful, powerful speech. Thank you very much, Isaiah. And with that, everybody, thank you for joining us. And please do take the opportunity to speak to our panelists who have made the long journeys to be here. Thanks very much. We're closing the meeting now. Bye.